Welcome to Muted in Medicine, the podcast where we break the silence on the untold stories and pressing issues within the healthcare profession. Join us as we dive deep into topics that often linger in the shadows of medical corridors and are not discussed in conferences, meetings, social gatherings, and in the hallways. They are often hiding. From navigating errors and facing litigation to the often overlooked realm of mental health among healthcare professionals. Through candid conversations and storytelling, we aim to amplify the voices and shed light on challenges that resonate across the medical landscape. So grab your stethoscope and a cup of coffee and tune in as we uncover the layers of complexity in the world of healthcare that are so muted yet so profoundly impactful.
Hello, everyone, and welcome to another episode of Muted in Medicine podcast. My name is Saba Fatima, and I'll be your host for this podcast. I'm a pediatrician with a passion for helping healthcare professionals facing secondary trauma at work in healthcare, which often they're unprepared to face, and spreading more awareness about it. And with this podcast, we hope to discuss some of the most silenced topics in medicine that are often not openly discussed. Today, we're talking about illness and disability in the healthcare provider. As healthcare providers, we're expected to be the epitome of perfection, mental, and physical health. And we're asked to thrive in a culture of invincibility. So when illness strikes, challenging that ideal, we often face much internal and external stigma that we are less than. There's also often a deep grief about not being able to face the extreme physical demands and the consideration of how your career could change because your body has now betrayed you. From personal experience, it is terrifying, to say the least. And so today we're going to speak about this to make it less scary for our listeners who might be going through the same. To discuss this with me today, I have Dr. Manisha Rayavarapu. She was a family physician and author of the book Butterflies, Boards, and Blessings, a doctor's journey to thriving with lupus. And in her book, she talks about her journey of being diagnosed with lupus in residency and how it impacted all aspects of her life. We're very excited to have her. Dr. Rayavarapu, welcome to the show.
Hello, thank you so much, Dr. Saba, for having me on today. I'm very excited to talk about this topic that is very near and dear to me. So thank you very much.
Yeah, thank you so much. So we ask everyone this question, and I want to keep the tradition. When you think about healthcare and medicine, and when you were practicing medicine, what brought you joy in medicine? Or when you think about it today, what brings you joy?
When I think about what brought me joy in medicine, it was just the relationships and the connections I made with the people, my patients, my colleagues. I think that's the real heart of it for me. It's people and those connections, those deep relationships that you form those bonds. Yes.
Yeah, absolutely. Yeah, I agree. And I think that's been a common answer to all of the people that I've asked this question. So I think we kind of agree on that. I haven't gotten a chance to read your book yet, but very intrigued. Would you like to share your personal journey with lupus and your chronic illness? How did it begin? And how it has it impacted your life as a healthcare provider?
Yes. So I actually had symptoms when I think probably starting when I was a teenager, but I didn't notice it. My parents didn't notice it. It was the fatigue, a little bit of hair loss, a joint pain occasionally. I think I really didn't develop some major symptoms until residency. And I was dealing with joint pain on a regular basis, a lot of hair loss, like clogging the toilet or shower, hair loss, and extreme fatigue. But you're a resident, you're running up and down stairs, you're working 60 to 80 hour work week. So I just attribute it to just residency stress. Things really came to kind of a point when in towards the end of my second year of residency, I had an extreme amount of pain and my face was swollen. My face was so swollen, my eyes were like tiny slits that I couldn't even see out of. And so that's when I said, oh, well, maybe I need to go see a doctor. So
Yeah.
I did, he did some blood work, started me on some steroids and sent me to a rheumatologist. And then within 2 weeks, thankfully, I was able to have a diagnosis, but that was a start of a very, very long journey. Yes.
Yeah. And so how did it impact then what you were going to do in healthcare?
At that time, I wanted to stay. I wanted to stay. I wanted to work. I mean, I had been working with this pain anyways, this whole year. So I wanted to continue on. There was definitely a lot of pushback. Surprisingly, from my friends, my colleagues, people I trusted, thought would have my back, saying, pushing for me to take like mandatory medical leave of absence. And, I was able to, I had completed hospital rotations already and really only had clinic left. And I said, this is something I can do. And I'm thankfully my program director and the clinic director were very graceful about it and they allowed me to stay. But it was definitely, I thought that there would be some sympathy. I expected, since we are doctors, we're medical people, we should understand this. We should try and help the other person. No, it was not like that. There were a few people who were, yes. And, they were willing to cover a couple of my calls for me. And my program director, like I said, clinic director were very understanding. But then there were a good portion of people who said I should just take a leave and that it was a liability for me to be working.
Okay. Yeah. That's like really surprising. It took me for a surprise for a minute when you said that and how having an illness can predispose you to be a liability. Did that surprise you at that point or disappoint you?
It surprised me. It disappointed me. It hurt me. It was said, I wouldn't make it to the codes in time and I wouldn't be able to run up the stairs. I wouldn't be able to do this and that, but I've been doing it the whole year. So, just got to push through it and pop a few leaves, do what you can, right? They were worried I'd be taking time off for doctor's appointments and hospitalization. So it's all understandable, especially during residency where it's very stressful for everybody, but it was surprising that there wasn't support like I expected.
Yeah. And so you finished residency in the same program?
Yes,
or?
I did.
Okay. And then what happened after in terms of your career? If you don't mind sharing.
Oh, of course. I started working. I got a job, full-time position. And I did that for, I think the first year I did full-time. And then second year I had to modify hours. I modified to, I think I did 32 instead of 40. Because it was really taking a toll on my body. I was getting sick all the time, hospitalizations, and those I hid. I even hid them, just been like, oh, I had a really bad, ear infection or threw my back out or whatever I could say. Because usually my hospitalizations were only a night or two, but I was having hospitalizations. I was so tired. My body was just, the stress and the work of it was just damaging me. So I ended up doing the 32 hours, and even the 32 hours was a lot. It was really hard on my body.
Yeah. Why did you feel like you needed to hide when you were ill? I'm just curious.
Well, because I wasn't sure how it would be taken. I was afraid of being seen as weak, as not competent, as less than my colleagues, and I was correct. I eventually had to disclose to my employer my situation because I guess there was a little bit too much time off. I was also doing infusions. And so that
Yeah.
basically was once a month of my life gone, a whole day.
Hmm.
By the time I
Yeah.
went to the place, got the infusion, a whole day was gone out of the work week. And
Sure.
so there was a lot of time. And I did those infusions on my shortened day. That was only like a half day, but still, it just. And when I and ended up having to disclose it, they basically held it over my head, saying things like, "You're not going to find another job, and basically you have to do whatever we tell you to do because no one else is going to
Uh-huh.
hire you."
Okay. Okay. So that sounds like an environment where you wouldn't want to keep working, right? Like that's not a supportive environment where it probably encourages you to quit. And it kind of brings a point that there's this internal stigma, yes, that I'm feeling not feeling good enough as my coworkers, but there's also an external stigma
Mm-hmm.
associated with being ill. And like we talked about, we're expected to be strong and healthy and the fixers, and God forbid if something happens to us. How have you navigated this stigma? It sounds like it was a tough journey for you, and my apologies. I think I'm unable to be more empathetic because I'm just so shocked at what you're telling me. But what was that impact on you, and how have you navigated it?
It was hard to navigate that for me. I really did feel less than. It really took a very big hit on my mental health. My self-esteem was extremely low because of it. Um, I really just did not feel like a full and complete person. I did not. I knew that I was. I knew that I was a damn good doctor. I I worked hard. My patients loved me. I loved them, and I did a good job. But still, no matter how many good reviews or how many praises from my patients or good positive results, better lab results in my patients, better this, better that, it didn't matter because in my mind, I still felt like I wasn't good enough. I was less than because of my illness.
Yeah. And so, how many years in that practice, and then what happened afterwards? Did you decide to stay away from medicine for a while, or what happened?
Well, I was there for two months or 2 years, I mean total, because it got really toxic. It got really toxic for me after I disclosed my illness. I ended up taking probably almost a 6 month break, and I was almost at a point where I was like, I don't think I'm going to practice medicine anymore. I'm done. I can't do this. And I actually got offered a job when I wasn't looking. The recruiters.
Yeah.
I was offered a job to work 3 days a week on like a mobile bus,
Oh,
but
okay.
it stayed in one spot, and it was
Yeah.
just it was after Hurricane Sandy. So Long
Yeah.
Beach, where I lived, had
Yeah.
had everything was destroyed. A lot of the buildings and the businesses. So they had a mobile bus offering healthcare, and so I was the doctor on the bus, and the hours were I think like 8:30 to 4:30. It was easy. I mean, it wasn't like packed with patients. It was
Yeah.
it was a more restful job, and it was a really great opportunity to bond with patients because I had more time, and
Yeah.
they were coming. They were really in need, and I really felt like I was doing a good service there. But the term was only meant to be. It was a locums job. It was only meant to be 1 year, and they extended it to, I think, another 6 months, and then
Yeah.
yeah. Then after that was over, my husband, he's vascular surgery, so he ended up having to do fellowship in Staten Island. So I ended up moving there and started working at a new practice,
Mm.
hospital satellite practice, and it was good because it was a new practice. I was building my own clientele. I was working part time then too. I think it was 3 days a week there as well, and it was great. It was doable. And then I moved eventually to Florida, where I worked once again, 3 days a week till they basically told me, well, we need you more than 3 days a week. We need you 4 days a week or we're letting you go. And I said, no, I'm not working 4 days a week. So they let me go, and then they needed help. So I came on doing locums for them for a while. Or per diem, I should say. It wasn't really locums, it was per diem. So I did per diem for them for a little while after they basically let me go. And I needed work. And
Yeah.
after that, I got pregnant with my son. And because it was a high-risk pregnancy, I decided it was time to stop working.
Yeah.
So that's kind of the story.
So it's as it stands now, you don't practice medicine currently
Correct.
on this day?
Correct. I did do telemedicine for a little while after the baby was born. But to me, there was no connection. That the piece of medicine that I loved was gone.
Yeah. And how did that impact you? The decision where you decided, hey, I'm not going to do this anymore. And when as I'm hearing your story, I feel like there's a lot of external limitations for you to be able to do work because you still kind of wanted to do, and that's just an assumption. You wanted to be a doctor, and you were damn good at it, as you said. So how does it feel?
This may surprise you, but I loved that I was doing good in the world, and I loved the relationships and connections with my patients, but I did not love medicine. Never loved medicine. Parents' dream, did it for them. So honestly, when I had my chance to take an out, I took the out.
Yeah. And is it just medicine in itself, or were you more disenfranchised with it because of all the things that happened to you? What do you think?
I think it's a mix of both. Part of it is it really wasn't my dream. I really did not care about medical stuff. I would have rather gone into psychology or art. I like to write. But, and the other part of it is the entire experience was not a very great one. The way healthcare
No.
was awful. It was not what I grew up. My parents are both nurses. So I was around the medical field a lot, and back then I think it was very different, and things changed a lot, and it became so much more a business than a noble career of helping people.
Yeah.
It became a lot of paperwork. It became a lot of hands tied behind your back, not really truly being able to give your patients the time or the resources or the help that they needed. It stopped being fulfilling.
Yeah. It kind of went against everything that we imagined, I guess, when we started
Mm-hmm.
doing med school. Yeah. A lot of corporate, I personally think, yeah, a lot of corporatization of the institutions and a lot of it driven by money. But I mean, I still believe what happened with you was really surprising. And I think the institutions could have played, I mean, it goes without saying, could have played a better role in supporting you and help you um, maybe stay in it. What role do you think healthcare institutions should play in supporting providers with chronic illness? I knew nothing about it. Obviously, I was very oblivious until I got diagnosed with the chronic illness, and I'm just navigating it as it goes. I don't know what my story is going to be, but I just wonder the need for you to have to hide your illness and to make excuses for it. It just sounds very archaic in today's world and day. So what do you think institutions can do better?
I think the stigma needs to be removed. I don't know how that's going to happen, but the stigma itself needs to be removed. I do think accommodations should be made, and I don't say this just for physicians with chronic illness. For everybody, um, we're human beings. We're not gods. We're human beings. We get sick. We have accidents. We go work out in the gym and pull our back. We get into car accidents, anything. As we are human beings, we're people. And so I think there needs to be a little accommodation made, where you're able to take the time off you need to go to a doctor's appointment, to get your mammogram, to do your screening so you don't end up sick. So
Yeah.
I definitely think that's an accommodation that should be made without having to take away all your PTO or time off, because that is so precious and valuable to us. And we give so much. We should be able to get at least that. for
Yeah.
ourselves.
Yeah. Like there's, I think the concept of being sick is just, even if you don't have chronic illness, is so um, taboo, I would say, in medicine that I don't know, when I thought when I did medical school or residency, unless you're dying, you're supposed to come in, right? Like
Yes.
you can't.
Yes.
uh, and I try to do better, like for the trainees and the people I work with, because I feel like, yeah, but like if you have a cold, like you can go on to work coughing on everybody else. Like that's not
I
right.
don't understand.
Well, I mean, where do you think that comes from? Like, I don't, I just wonder about it. And then, so being a person with a chronic illness who has to daily struggle with their pain, that's bad, right? Because if we can't even navigate a cold or flu in healthcare.
Yeah, it, it's awful.
Um, would you have done something differently when you think about it? I'm just thinking about in terms of financially, because you didn't know about this illness and you were working in healthcare. Would you have done something differently now that you think about it? Had you been able to predict this? Because I know we can never predict it, but
Well, number one, I wouldn't have gone into medicine, but then I would never have gone in.
yeah.
If I had that option, I would have taken it a long time ago. But with the amount of debt, I think that was a big driving factor for me to keep working
Yeah.
and finish residency. Actually, that is probably the biggest factor of finishing residency was I
Yeah.
have so much debt. There's no other job that I'm going to be able to get that is going to pay those loans off. That definitely was something that weighed over me. So, I mean, if I knew I was going to have lupus, I probably would have chose something that wouldn't require a lot of debt, or I would be able to get more assistance for, so I wouldn't be stuck with the debt.
Yeah.
I think and I would probably choose something that was a little less taxing,
Hmm.
not as much on your feet work.
And then I know we talked earlier about off camera about disability insurance. Did you know about disability insurance at that time? And did you get it beforehand? Because I didn't. So,
So while we were in residency, actually, it was the people were coming to the hospital
hmm.
and saying, "Oh, get the disability insurance, get this. You never know what's going to happen to you." And I actually was in the process of talking to someone and making the decision to get the disability, deciding, do I want to do this? They push, you got to do it when you're young, when you're healthy. And so I was about to pull the trigger on that. And lo and behold, I got sick. And what ended up happening was I was able to get the disability insurance, but it was very hard. Number one, they gave me one
Hmm.
of the more smaller, obscure disability insurances, and they underwrote it with a rider saying, I will not get disability for anything lupus related.
So I
So
would say the time to get disability insurance is when you're healthy. And I don't think a lot of people know about that. And so I just really, would you agree with that?
I do agree, but I think a lot of times when you're young like that and you're in residency or whatever, you don't have a lot of extra cash. So you think, I
Right.
don't want to spend the money on that. And I think that was the main thing, that was like, do I want to spend the money on this? I'm young, I'm healthy. Let me wait till I am actually making money to, and you're not even making that much money to almost have it be worth it. But the truth
Yeah.
is, you get it so that when you do need it later and you are making money later, you
Yeah.
have it. And so, I took a little long to make my decision, I guess, and that's the price I paid.
I did not get disability insurance. I got diagnosed when I'd been doing it for 3 years, like a attending job, and I
Mm-hmm.
still hadn't bought it. And so then after I found out when I got diagnosed that there was something that I should have done it. So I think there's less education about it as well,
Mm-hmm.
and definitely get it in residency if you're healthy. And
Yes.
even I mean, if you don't have cash, then definitely think about it as soon as you get out of your residency, to get it would be is something that I've learned. What are, I think, some of the, and there's probably, do you know what some of the workplace policies in place you think should be around in healthcare to protect individuals with disability or chronic illness? And you may not know what's currently there, but
I don't know what's currently there. And in all honesty, don't know what kind of policy would need to be made. I'm not really good at thinking about those type of things. I know there should be some kind of a policy. I'm just not quite sure what it would need to say.
yeah.
Or
But it sounds like in a few of your jobs, you did not get any much accommodations that you requested. Yeah.
mm-mm.
Yeah. Did you ever go through HR to try to find it out how you could have been protected, or no? I'm just curious.
HR was just as bad.
Yeah.
HR
Okay.
is basically the lapdog of the owner who is non-medical. So
How I know you talked earlier about disclosing the chronic illness to your colleagues, and it took you a while to do it. How should you think healthcare providers navigate this disclosure to the patients and their colleagues, and what could be the potential implications of such disclosures as well?
with my colleagues in residency, because I really didn't think there was anything wrong in saying it, everyone knew, and so that was a mistake, or maybe it wasn't. But going forward, I did not let my staff know unless I was very, very close with them, or my colleagues, same thing. I did not let them know unless I was very close with them and trusted them. How after we had built a friendship, more than just a work relationship, an actual friendship.
Yeah.
Same thing goes with my patients. The patients that I trusted, felt close with, especially if I knew it would help them, which is part of what I did. With my patients, who had chronic illnesses or even anything that they were struggling with. If it was a patient I had a very good relationship with, I would share that with them in means of encouragement. And that's also why I had written my book, because that was another opportunity to share the story, um, and help people to feel encouraged. Because a lot of times when you're diagnosed with something like this, you kind of give up. You're like, this is it. Like, I'm done. There's nothing I can do about it. But that's not true. That's not true. I finished residency. I was able to practice. I had to make some adjustments, but I was still, I feel, able to accomplish some really good and great things. And so I think that's part of my purpose. And I think those of us who have it and are succeeding in life and are doing well and are trying, I think we do have a duty to help and encourage those who are struggling, especially the ones who are new to having a chronic illness. It's our duty and kind of our obligation, and it's a nice thing to do. And so I will share my story with other people, with the world, with my patients. But there is one thing. I waited till I was out of practice completely, and I had made the decision that I was no longer practicing. So I did wait until I knew I was done.
Because you felt there was a certain risk
Yes, if I were to
to
get another job, yes, I did feel there was a certain risk.
how what would you recommend to other people? How can we thrive with this to some extent with a chronic illness, and
I
especially if you're working in healthcare?
I think the ways to thrive are to put yourself first, your health first. You have to do that. You have to take care of yourself, practice self-care. You have to make sure you're going to your appointments, you're doing your blood work, you're getting the rest that you need. You have to find a way. It may mean working a little less, taking a little bit of a pay cut, but you have to put your health first. That's one of the major things. Um, and then I think also thriving with the disease, also making sure you take care of your mental health too. I don't want to forget that, because that's also a big part of it. Taking care of your mental health, making sure you're doing things, exercising, eating well. The other thing is building yourself a good support system, a strong support system, people who got your back, people who will care for you, people who understand, people who are there to support, to love, to lift you up. I think that's really what has gotten me through it. I have a very loving family. I have an amazing husband who's gone above and beyond, and it is these things that help you to thrive. And then also helping others. When you help others, you're giving back to yourself. So these
Yeah.
are all parts of thriving, I think.
Yeah. Yeah. That's very important. I think what you said about taking care of yourself and putting yourself first, because often that's something that we do struggle with, of how to put ourselves
Mhm.
first, especially in healthcare, because we're not taught to do that, right? Also, like if somebody is struggling with this illness, and we talked about how the feeling is so terrifying, if feeling not as good as your colleagues or peers or people that you're working with, just feeling weak and incompetent, and you used all those terminologies. Do you have any advice, because you've gone through it, for other healthcare professionals who are struggling with it, how to struggle with that feeling, how to get to the other end of that?
So that was a tough one for me. I think what kind of got me through that, other than the support system that I had in place, and like I said, they were really good. I had really good people in my life. The other thing is you have to focus on what you can do, not what you can't do. You have to always focus on what you have, not what you don't have. And I think that's important. When you focus on the positive aspects of your life, the positive things that you're doing, rather than, oh, I can't do this. And that's one of the big things I talk about is focus on what you can do, not what you can't do. And then for me personally, another thing that was very important for me is my faith. I am deeply spiritual religious. And for me, prayer, spending time with God, doing my devotions, those were a big thing for me because I believe God loves and values all of us. So for me, that is, if God sees me as valuable and worthy, then yes, I am. So, those things, those are the things that really helped with feeling like a good, worthy person, because I am a good person. I've helped a lot of people. I'm good.
Yeah. Yeah. The disease does not define you, right? Like
Right.
that's just something that impacted you, but it does not define you. And I mean, a lot of like, I also feel like initially when you're diagnosed with something, it's just very like a big shock and change to your body. But with time, you can do and thrive to do the things that you want to do. And just keeping that hope in mind, I think, when something like this happens is important. What fills your cup today?
What fills my cup today? What fills my cup today? Well,
You can think about it.
tea. No, I'm kidding.
Yeah.
But my family, my 5-year-old son, who is
Mhm.
so much energy. Um, what else? My husband, my family, my friends, my writing. I write poetry now.
Yeah. Very nice.
I published that my memoir a few years back, but now I'm writing poetry. I've got a couple work in progress novels. So
Very nice.
I exercise every day, work out with a personal trainer. That gives me that, those endorphins that make me
Yeah.
feel good. I take care of myself. I take care of my body. I get naps every day. Oh yes.
Good for you.
It may only be like 20 or 30 minutes, but I get me a nap
Yeah.
every day. I try and eat healthy, but I like to eat, but I try and keep it healthy. So I take care of myself. I take care of myself. I take care of the people I love.
Yeah. That's awesome. If there was somebody who is in healthcare and they're kind of debating this decision of whether they should stay or they should leave, what would you be your thoughts to them or wisdom?
Well, I think it's a very personal decision. For me, it was an easy one because, like I said, I never wanted to go into medicine. But
Yeah.
if this is their dream and this is what they love, they should do it. But they do need to weigh out the cons and the pros and find out what's really important to them at the end of the day. Is continuing to practice medicine at the end of the day more important to them, or is being able to care for themselves and their family more important? And
Yeah.
whichever one they decide to do, there's going to be some good parts to that and some bad parts to that. And as long as you're aware of what the bad parts of it are and you're willing to accept it and willing to work with it, I mean, I think most things can be worked with. So
Yeah.
it's a very personal decision, but you just weigh it out for what's best for you. It's not it's not a blanket answer.
I agree. It's very personal and you can do whatever you decide to do. And it's okay if you don't stay and it's okay if you stay either. Like
Absolutely.
both ways are fine. Yeah.
Absolutely.
Yeah. Just to
There's no shame in leaving medicine. And there's no shame in
Yeah,
staying.
and there's no shame. I think also I'm gonna say in being ill and doing it with a chronic illness, except it's absolutely brave. And um, so, tell me more about your book. What is it about? What do you write in it? What inspired you to write it?
So it's titled Butterflies, Boards, and Blessings, A Doctor's Journey to Thriving with Lupus. And so the butterflies is indicative of that butterfly rash. And then the
Mhm.
boards, of course, boards is medicine. And then blessings, that's my faith, because faith does play a very huge part in my journey. And so in my book, I really wrote it because I wanted to get my story out there. I wanted to share it. I wanted to be able to help people who are struggling like me. And it kind of helps me process it too. Writing the book helped me process it. Um, and it helped me to help others. And so I kind of talk about all the different things, you know, how it affected my work life, my careers, how it affected my friendships. You know, you lose friends and you find out who your real friends are during these times, because when you can't go out to the club with them, sometimes they drop you. Things like that,
Yeah.
or they don't understand. No, I cannot drive an hour to come see you. No, I just can't do that.
Yeah.
Things like that. And then, so there's a whole chapter on my relationship with my husband, because he got diagnosed and we had just started dating, and we were faced with questions like freezing my eggs. And it's like, I've only been dating
Oh,
this
wow.
guy for like 2 months and I'm talking to him about this stuff. And we ended up moving in 4 months after I got sick. We moved in together because I was having a hard time with caring for myself, needing help going to the bathroom, getting out of bed, going to the bathroom at night, needing help brushing my hair. And my wonderful husband, who was my boyfriend at that time, was there for me and helped me, driving me into work. We met in residency, so we could ride in together. But um, I talk a lot about that and how it affects your relationships. You know, I was on steroids. I was not a nice person when I was on those high dose steroids. It talks about my mental health. I talk about, my faith, how it affected my relationship with my family, because this disease doesn't just affect one part of your life. It affects everything in your life. It talks about my own feelings about myself. So I really wanted to bring that to the present, where that all was discussed, not just my disease makes me sick and I can't work, because it's more than that. A lot
Yes.
of people living with lupus do not have support from their partners or their friends or families or anybody. So I wanted to talk about that and make that aware. I wanted to bring awareness to that. And, I put the book out there talking about all the aspects of what this disease does and how I navigated it, how I thrived with it. And then at the back chapter, just put in some of a little bit of tips for dealing with certain things, kind of like a little self-help portion. And it's amazing because the amount of emails and messages I got on Facebook, or just messages from people saying thank you. I thought my life was over. Young people starting their lives, thinking, oh my goodness, now I can't go to college, now I can't go to medical school, now I can't do this. Really, and I got a lot of emails. I got to speak, or not speak, but email back and really help and encourage and weigh out things with people. It gave me that opportunity to help more people who reached out to me, and I got messages. You've encouraged me. Thank you for writing this. Now I have something to give my husband, my wife, my this, my that, because when you tell, how when you tell someone something, they don't necessarily always believe it, or understand it. But if
Mhm.
someone else tells you or tells them, then they do. And so
Yeah.
this book was a good thing to be like, here, honey, read this. A
Yeah.
doctor wrote this, and this is what she's saying. So it's true.
Yeah.
So um, I think I served my purpose, and it fulfilled what I wanted it to fulfill, and it did what I wanted it to do. So I'm happy with that.
That's absolutely amazing, and I think it may have healed you a little bit, but it healed so many other people as
It
well with
definitely
what you
healed
wrote.
me.
So,
Definitely healed me too.
yeah. That's remarkable. I would love to read it someday. Is I think we're getting to our end. Is There's something that you would like as parting words to tell our audience or whoever's listening and has a chronic illness and maybe they're struggling with their mental health? And I know I've asked you this question a few times maybe throughout this, but there's something that you would like to say as your parting words.
I would like to say that I think as people living with chronic illness, we really need to stick together. We need to find our people. We need to build our support systems. We need to band together, not just for support, but also for awareness and for change. Many can, one can make a change, but many can make big changes too. So I think that's what we should do moving forward. There are a lot of us. And if we band together, I think we can make changes in the healthcare system, in the way things are done, in the way we are seen. I think that is huge. And I also wanted to include for the physicians who are dealing with this, we are not alone. There are groups on Facebook that I'm part of. One is called Raise, and
Mhm.
another one is called Physicians for Physicians. And these groups are a big source of support, but also information, because a lot of us don't even know what we can do. A lot of us don't even know how to get on disability. And so there are resources. These are the physician resources I'm mentioning, but for non-physicians, there are those resources too. You just got to find them. And they are designed to help you, to support you, to let you know what's out there for you. So, that's
Yeah.
just something I wanted to include as well.
Yeah, that's so important. Thank you so much for being with us today. It was really remarkable to talk to you, hear your story, and just all the positive advice that you have for our listeners. And very excited to read your book as well at some point. I know you like poetry, and we have this tradition on our podcast that we end the podcast with a poem, and I try to find a different poem every time. So if you will sit with me through it, I just want to read one poem for our audience,
Yes.
and then we'll end. So the poem is called Wait by Galway Kinnell. Wait for now. Distrust everything if you have to, but trust the hours. Haven't they carried you everywhere up to now? Personal events will become interesting again. Hair will become interesting. Pain will become interesting. Buds that open out of season will become interesting. Second-hand gloves will become lovely again. Their memories are what give them the need for other hands. And the desolation of lovers is the same. That enormous emptiness, carved out of such tiny beings as we are, asks to be filled. The need for the new love is faithfulness to the old. Wait. Don't go too early. You're tired, but everyone's tired. But no one is tired enough. Only wait a little and listen. Music of hair, music of pain, music of looms weaving all our loves again. Be there to hear it. It will be the only time, most of all, to hear the flute of your whole existence, rehearsed by the sorrows, plays itself into total exhaustion. Thank you so much for having us, being with us on this podcast today. Yeah, you did. You absolutely did. Thank you.